We don't distinguish between your ability to pay when you enter the hospital. A large percentage of our patients are government reimbursement or no pay. In other words, they have no insurance of any kind and they don't qualify for any government program. Typically, we get paid, if anything, less than the actual cost of that care. So what do we do with the shortfall? We reallocate it to those who can pay. What does this mean? It means that every insured person is paying more than what his care cost over time to pay for everybody else's care who doesn't have any insurance. This is an actuarial model that isn't sustainable. 5% of the insured population in central Indiana, the same in Michigan, Illinois, Ohio, all of the upper Midwest, account for close to 50% of the care. 20% account for nothing. So we need to have everybody in the same risk pool and everybody to have an insurance payor or a model of payment so that we're not just shifting the cost. I think many parents will relate to what I'm about to say. If you've got a kid in college, you know that some kids are paying more tuition than other kids, but the cost of the education is the same to the institution. So they give the kid the football scholarship or the poetry scholarship. Some kid who's not getting that scholarship is paying more tuition to pay for that. It's the same in healthcare. So really, does that make healthcare costs, in essence, a hidden tax when you pay for somebody else's healthcare? Everybody understands the concept that when somebody has a traffic accident and their fender is bent, everybody pays for it. When there's a hailstorm in the Midwest, everybody pays for it. When there's a storm on the Florida coast, everybody pays for it. Likewise in healthcare. When a person who is underinsured or uninsured, or even an insured person, has a very expensive treatment, a heart attack, a stroke, a premature low birth weight baby who spends 30 or 40 days in the neonatal intensive care unit, that's a catastrophic event. It's a car wreck. You can't afford to pay for your own car wreck. You spread the cost among thousands of people. That happens in healthcare. So the cost is simply shifted to everybody else. Well, as our population gets older and sicker, and fewer people have commercial insurance through their employer, there's more and more to shift to fewer and fewer people. That's why folks are complaining about the cost of healthcare who run small businesses. They just can't afford it. That's the cost shifting aspect of it. How do you reduce the cost shifting? You treat everybody as if they're in the same risk pool, and you provide the primary care clinics in the neighborhoods or some form of government subsidized health insurance. There's only two ways to subsidize health insurance. One is to give people grants. That will not happen in this country for health care, or to have a plan into which everybody pays, like automobile insurance or life insurance, and you get the benefits of that plan when you have an event that requires health care.